Fibroids are fed through estrogen, right? It's their feeder source. What we don't know is like why some women will have 2 centimeter fibroids that will be there for 10, 20 years, and why some women will have a 2 centimeter fibroid that'll grow to a 20 centimeter fibroid in a couple years. We don't know the answer to that. But what we do know that estrogen is the feeder source, meaning that as long as you have estrogen production, your fibroid can get bigger. So it leads us to the question of what happens during menopause. So during menopause, the ovaries start to decline and they do not produce estrogen progesterone anymore. So yes, it is true that fibroids will regress and lose some size during menopause, but it's not very significant. So if you have advanced fibroid disease, like a fibroid bigger than 10 centimeters, it's not like once you hit menopause, it's going to shrink down to 2 centimeters or it's going to just disintegrate because there's no estrogen. It may lose a couple of centimeters, but it's still going to be relatively big. As opposed to some women that have very smaller fibroids, they're not going to necessarily go away, but they will lose some size and volume. The bigger thing with menopause is that now that you don't have the production of estrogen progesterone by the ovaries, now the symptoms of bleeding will go away, or the symptoms that the fibroids were causing, if they're smaller, will now not present because you won't have the heavy bleeding. But if your symptoms from the fibroids being large are, just pain in your pelvis or big belly because they're so big, or it's pushing on your bladder, causing frequency of urination or causing pain with sex, don't rely on menopause to now shrink them so that those symptoms go away. It may lose some size, but not enough size for it to be completely gone. Kind of look at it like when we get older, we lose maybe an inch or two. If you're 6 feet, now you're going to be 5'10" or 5'9" when you're 80 or 90, but you're still going to be relatively tall. You're not going to go from 6 feet to 4 feet because now you're 80, 85. It's very marginal losses of size. And that's exactly what's going to happen with fibroids for those women with fibroids and advanced fibroid disease. Hope this helps.